Hello and welcome to the Case Crew and those of you who have just found this channel and are just popping in. Just to start with, if true crime is less about facts and more about accents for you, this might not be the channel, but thanks very much for the view. You might hear a Northern British accent here. That's part of what makes Case Continued different. If it's not for you, that's okay. Let's keep the focus on the cases, not the creators. This week, we are continuing on with our Chris Watts, Shanann Watts deep dive. So, the bodies were recovered, the autopsies were conducted, but what wasn't found, the diagnoses, the toxins, the trauma that some expected, has raised more questions than it answered. In a case where speculation runs wild, today we turn to cold, clinical fact, because sometimes what's missing tells the loudest story. I'm Fiona, and this is Case Continued. This is going to be a quite document-heavy video because we are going through the autopsy reports and I'm going to be just having them here on the screen for you to go through with me. If you're here for a lot of visuals, there isn't going to be that many in this video. Before we start, I do need to make a vocal disclaimer as well, separate to the one that I have at the start. Because we are looking at autopsy reports, there are some of you out there that could find this video disturbing and it might be upsetting for some of you out there. If it's something that you feel that you would like to watch, please just make sure that you take care of yourselves as we go through it all. If getting into the medical nitty-gritty is something that you don't feel is for you, that is absolutely fine and I understand your decision to click out. Your well-being is more important than my video. Please do just come back for next week where we'll be moving on to a slightly less medical-based topic. So a big question in this case is, why do we not have access to Shanann's medical history? And why don't we have access to Bella and Celeste's medical history? There's such a thing as patient privacy laws, and medical records are protected by strict privacy laws, like the HIPAA in the US, which prevent doctors, hospitals, or insurers from sharing patient information without explicit consent. Since Shanann is deceased, her private health information remains confidential unless released by her legal next of kin. There's legal and ethical boundaries to consider when sharing medical information. Health professionals and institutions are bound by these ethical standards and legal restrictions that prohibit them from discussing or confirming someone's medical conditions publicly without authorization. The only medical details about Shanann's health or the girl's health that have been publicly shared come from the discovery, media reports, or statements made by Shanann herself, mainly through her social media and family and friend disclosures. Now, there's a group of people on the internet who question every aspect of the autopsy reports, and they question every aspect of Shanann's diagnosis of lupus and Bella and Cece's medical complaints. They ask the question, why have no doctors publicly corroborated Shanann's lupus diagnosis? Even if some medical professionals who treated Shanann could confirm a diagnosis, they can't do so publicly without consent from her family or her estate. There's no legal or medical obligation for doctors to validate or deny a patient's health conditions in high-profile cases, unless it's part of an ongoing investigation or court proceedings. But it is really important to remember that no doctor has also ever publicly disputed her lupus diagnosis or suggested it was fabricated. The absence of public confirmation doesn't mean the diagnosis wasn't real. It often means privacy is being respected. What we all need to remember in this case is that there are living people still involved who are affected by these kinds of demands for information to be made public. This is their family. Shanann was a daughter. She was a sister. If the shoe was on the other foot for those people that are saying that we must have Shanann's medical records released, if she was your daughter, would you want all of her personal information thrown out to the world? If you were the mother of a deceased lady, would you think it necessary for the world to know exactly what medication your daughter took, what treatments she was under, exactly what her symptoms were? Would you want all that information given out to everyone? People who don't know you, don't know your deceased daughter or son, and have nothing to do with the case. Would you really agree to that? Because I'm not convinced that I would. I wouldn't want my medical records presented to the entire world to scrutinise and mock. What difference does it make in this case? That's a question that we're going to answer in a little while. Now, Shanann publicly discussed her lupus diagnosis on social media and in videos. She described symptoms and treatments, which many observers took at face value. We need to remember that lupus is a complex and sometimes invisible illness that often requires medical privacy and discretion, and we will get more into lupus a bit later in this episode. Without medical records or professional statements, we rely on available evidence, respectful consideration, and acknowledgement of privacy rights. And that seems to be what some people are missing, that there is such a thing as a right to privacy. When Shanann's autopsy was done, the medical examiner noted that rigor mortis, which is the stiffness that sets in after death, had already worn off in the major muscle groups. They also mentioned that livor mortis, the purplish discoloration that usually shows up on the lower parts of the body after death, wasn't clearly visible. And that could be due to something called postmortem artifact, which basically means changes that happened after the person had already passed away, like the way the body was moved or positioned. However, there was a noticeable pale area starting on the right side of the abdomen and stretching through the groin down to the right thigh. This area of blanching, or lighter skin, is likely the result of pressure. In other words, that part of the body was probably pressed up against something when the body was found. So in this case, it could have been the way that she was lying in the shallow grave. And this prevented blood from settling there like it normally would after death. We're going to go over some of the findings from the external examination in the autopsy report. Now, I'm not a medical professional by any stretch of the imagination. That is not my background. But I've spent quite a bit of time dissecting this autopsy, looking through medical journals and trying to get a full understanding of it and break it down into layman's terms so we can understand it together. Starting with the head. The hair is brown, evenly distributed and about 30 centimetres long at the crown. Some of it was coming loose from the scalp, which is normal after death. Moving to the eyes, they appeared cloudy. That's a common post-mortem change known as opacification. The eye colour was noted as brown and the pupils were the same size, measuring 0.4 centimetres. The whites of the eyes, called the sclera, were dull but still white in colour. There were no signs of petechiae. Those are the tiny red or purple spots that can suggest pressure or trauma in the whites of the eyes or in the inner eyelids. As for the nose, it was centred and dried out, which is again expected after death. There was no grating sound or feel when it was touched, which might have indicated broken cartilage or other injury. Looking inside the mouth, all of the natural teeth were present and in good condition. There were no signs of petechiae inside the cheeks, and the lips showed some mild drying, which is also normal after death. The neck was structurally normal, with no swelling of the lymph nodes. However, there was a noticeable pattern on the skin, a line of purple-black circular marks that varied in size. These extended from under the chin, along the jawline, and up the left side of the face toward the temple area. This is something the pathologist would have examined closely to determine if it was related to injury or just positioning. Moving down to the chest. The breast and nipple areas were described as normal for an adult female, and there were no lumps or masses felt beneath the skin. Finally, the abdomen was described as moderately swollen and firm to the touch. This is a condition known as protuberant and tense. However, the examiner did not detect any free-flowing fluid inside the abdominal cavity at that point. Now let's move on to some of the more sensitive details from the autopsy report. Please note that this may be a really difficult section for some viewers, so discretion is again advised. Starting with the genital area, the external features were described as normal for an adult female. However, the internal reproductive organs, specifically the uterus, were found protruding through the vaginal opening. This condition is likely a result of a combination of pregnancy and postmortem changes, and it's referred to as a prolapse. Near what appeared to be the uterus, examiners discovered a highly decomposed section of tissue that was covered in sandy debris from the gravesite. Upon closer inspection, this tissue was identified as a fetus. Due to the level of decomposition, the baby's gender and exact age could not be determined. However, measurements were taken. The crown to rump length was approximately 10.5 centimetres and the foot measured at about 0.7 to 0.8 centimetres. An umbilical cord measuring about 17 centimetres was attached to what was left of the placenta, which had ruptured and was also covered in sand and debris. The placenta, umbilical cord and membrane tissues were collected for evidence, and the fetus was transferred to the Colorado Bureau of Investigation for genetic testing. We're going to go into the details surrounding Nico later in the video for those that still have some questions surrounding that particular part of this report. Now to the limbs and extremities. The upper limbs, the arms, were well formed and symmetrical with all fingers present. The fingernails were long and in good condition, though they were heavily soiled with sand and debris from the burial site. Law enforcement had the fingernails carefully removed and preserved as evidence. The lower limbs, the legs, were also well developed and symmetrical with all toes present. The toenails were short and intact, but like the hands, were covered in a significant amount of sand. Lastly, the back and sacrum, the lower portion of the spine, were reported as unremarkable, meaning there were no visible injuries or abnormalities noted in that area. We'll now go over part of the internal autopsy findings. As always, I'll explain the medical terms in the most simple language that I can and approach this content with care and respect. To begin the internal examination, the pathologist performed a standard incision down the chest and the abdomen. This is routine in any full autopsy. They noted that the layer of body fat just beneath the skin, specifically around the belly button area, was about 2 centimetres thick. Looking inside the body cavities, which include the chest and abdominal areas, there was no abnormal fluid buildup and no unusual internal scarring or adhesions. However, the organs did show significant discoloration and a spongy appearance, which is common in bodies that have been deceased for some time. They were also noted to be very dry, likely due to decomposition and environmental exposure. Let's talk about the heart and the cardiovascular system. The heart weighed 210 grams, which is within a normal range for an adult female. Its outer surface, called the epicardium, looked normal. The main coronary arteries were open and unobstructed with no signs of blockages or clots. The arteries followed what's called a right dominant pattern, which is just a normal variation in how blood is supplied to the heart. When the heart was cut open for examination, there was no significant plaque buildup from atherosclerosis and no evidence of a recent heart attack. So atherosclerosis is the buildup of fats, cholesterol and other substances in and on the artery walls. They call that buildup a plaque, and the plaque can cause the arteries to narrow, which blocks the blood flow. The plaque can also burst, which can lead to a blood clot. Although it's often considered a heart condition, it can actually affect arteries anywhere in the body. The inner lining of the heart chambers, the valve structures, and the muscles that support the valves all appeared normal. The heart muscle itself had a healthy reddish-brown colour, was firm to the touch, and showed no scarring or damage. As for the aorta, the main artery that carries blood from the heart to the rest of the body, it had a smooth, healthy inner surface. There was only very minor streaking from atherosclerosis, which is often seen with age, and it's usually harmless at this level. Anyone of Shanann's age or older, like my age, will most likely show this atherosclerosis streaking at autopsy, and it's really not something to worry about. It doesn't mean atherosclerosis is in full swing or will even develop into any kind of serious problem. It really is just a natural part of the body's aging process. And it can be affected by things like your diet, cholesterol and fat intake. The major arteries branching off from the aorta, including those that supply blood to the stomach, intestines and kidneys, were all wide open and clear. The inferior vena cava, which is the large vein that carries blood from the lower body back up to the heart, was also normal. Overall, these findings show that there were no signs of heart disease, stroke, or trauma to any of the major vessels. From a cardiovascular standpoint, again, I'm not a medical professional. I've just been researching this through medical journals over the past couple of weeks. Everything appeared to be in normal condition, aside from changes that happened after death. Let's take a closer look at the internal organs as documented in the autopsy, continuing with the respiratory and digestive systems, as well as several major glands and organs. Starting with the lungs, the right lung weighed 280 grams and the left lung 320 grams. These weights are both within normal range. The internal structure of the lungs looked as expected, but the tissue was pale and showed signs of being atelectatic, which means that parts of the lungs had actually collapsed. And that is something that often happens after death and with decomposition. There were no visible tumours or areas of infection, and the trachea, the windpipe, along with the main airways, looked normal. Importantly, there were no foreign objects found in the airways, and the pulmonary arteries, which carry blood to the lungs, were clear, showing no signs of blood clots. Next is the spleen, which is part of the immune system. It weighed 120 grams and appeared soft, but otherwise healthy. The outer capsule was smooth and intact, and the tissue inside was red-purple and firm. There were no signs of damage, disease, or infection. Moving on to the liver and gallbladder, the liver weighed 900 grams. It looked normal, firm, red-brown, and with no visible tumours or abnormalities. The gallbladder, which stores bile, had a thin wall and contained a single well-formed gallstone. While gallstones are relatively common and not always symptomatic, this detail is noted in this autopsy for completeness. In the digestive system, the esophagus, the tube connecting the throat to the stomach, appeared normal in size and condition. The stomach itself was empty, and the inner lining was smooth and healthy, with no ulcers or signs of bleeding. The small and large intestines looked normal in both size and appearance, with no signs of disease or damage. The appendix, which is part of the large intestine, wasn't visible during the exam, likely due to decomposition or positioning. The pancreas, an organ that helps with digestion and blood sugar regulation, was described as tan orange with its normal lobed structure. There was no bleeding or fat breakdown in the area, both good signs that there were no major illnesses there. Finally, the adrenal glands, which sit on top of the kidneys and help to regulate hormones like cortisol and adrenaline. They appeared normal. The outer layer was golden and the inner portion was a healthy grey-brown, both typical findings. Overall, the internal organs, while affected by postmortem changes and environmental exposure, did not show signs of trauma, disease, or internal injury at this stage of the exam. Please just remember those last words, at this stage of the exam. Now we'll go through the final portion of the internal autopsy report, covering the genitourinary system, parts of the neck, the spinal column and the brain. Starting with the kidneys, the right kidney weighed 120 grams and the left 100 grams. These are within normal range, and the outer capsules of both kidneys came off easily, which is a typical finding, and their outer surfaces were smooth and red-purple in colour. Inside, the structures were clearly defined and there was no swelling or blocking in the ureters, which are the tubes that carry urine to the bladder. The bladder itself was empty and the inside lining was moist, pink tan and smooth. All normal findings. Moving to the female internal reproductive organs, the fallopian tubes and ovaries appeared normal. The uterus, however, was found to be prolapsed, meaning it had shifted downward and was partially pushed through the vaginal canal. This can happen after death, especially in pregnant women due to pressure and decomposition. The uterus weighed 480 grams and measured about 19 by 14 by 2 centimetres. When opened, it was mostly empty, with only some tissue fragments remaining. There was also some red-brown fluid and discoloration inside, likely the result of both pregnancy and postmortem changes. Shifting focus to the neck area, traumatic injuries were previously noted and described in earlier sections of the report. Internally, the neck muscles were smooth and dull, which is consistent with postmortem change rather than active injury. The epiglottis and the hypopharynx, parts of the airway, looked normal. The hyoid bone and thyroid cartilage, which are sometimes fractured in cases of strangulation, were both intact. There were no foreign objects in the airway and no swelling or other signs of injury. The thyroid gland looked healthy and symmetrical. In terms of the spine, the structure was normal overall. One interesting note was a piece of faintly visible hardware at the front of the cervical spine, around the C6 vertebra. This was from a prior surgery, possibly a spinal procedure done during life. Importantly, there were no signs of injury or bleeding around that area. And we know that Shanann had some neck surgery, and we can discuss that a little bit more later on too. Now let's talk about the brain and the skull. When the scalp was peeled back during the examination, the examiner noted some discoloration and congestion, likely due to postmortem changes rather than injury. The skull itself showed no signs of trauma, no bleeding inside the skull, and no bruising or lacerations. There were no signs of brain bleeding around the outer or inner layers of the brain, and the brain itself was very soft and discoloured, again, typical of decomposition. It weighed 1,080 grams, which is within normal range. The blood vessels, cranial nerves and brain structures all appeared symmetrical and undamaged. When the brain was sliced for further examination, there were no signs of stroke, bleeding or tumours in any region, including the cortex, white matter, brainstem or cerebellum. Lastly, the atlanto-occipital joint, which connects the spine to the skull, was intact. The neck had normal movement and there was no damage to the cervical spine, the uppermost part of the spinal column. Now, let's wrap up that autopsy report with a look at the specimens, toxicology testing, and the evidence that was collected during that examination. So, specimen-wise, during the autopsy, blood was collected from the spleen. This is commonly done when traditional blood sources have broken down due to decomposition. In addition to the blood, small samples from major organs were also preserved. These are taken to allow for further testing if needed later on. In terms of toxicology, the spleen blood was sent to NMS Labs, a specialised toxicology laboratory, for detailed analysis. This is standard in suspicious or unexplained deaths, and it helps determine if any substances, medications or toxins were present in the body at the time of death. In terms of the evidence that was collected, several important items were taken into evidence, including the fetus, which was carefully transferred to the Colorado Bureau of Investigation. This allows for future genetic testing if it's needed, and we know from the report that we've just gone through that genetic testing was indeed to take place. Multiple swabs were taken from the palms of the hands, the front and sides of the neck, and the face. These swabs are typically used to check for things like DNA, touch evidence, or foreign substances. X-rays were taken, both front and side views of the head and neck, to look for hidden injuries or fractures. Fingernail clippings from both hands were collected, as they can contain trace evidence like skin cells, fibres, or DNA from a struggle. And a DNA blood spot card was also made. This is used to preserve genetic material from the individual. When we come to histology and microscopic examination, it's really important to read what's being said here for those people who believe that the autopsy report shows as 100% proof that Shanann did not have lupus. So we're going to go through this little bit and then we're going to refer to it again later. And it's really important that we take in exactly what is being said and not just skim over some of the sentences that we don't like. Tissue samples from multiple organs and areas were prepared for microscopic analysis. This includes the heart, lungs, liver, kidneys, brain, several neck muscles, and parts of the thyroid area. These slides are reviewed under a microscope to check for signs of disease, injury, or anything abnormal. However, in this case, all of the tissues showed what is called marked postmortem autolysis. That means that the cells had broken down significantly due to decomposition, making it hard or impossible to detect any microscopic abnormalities. This is unfortunately really common in bodies that have been exposed to environmental elements for an extended time before discovery. We're just going to have a quick look there at postmortem changes in general and where autolysis comes in. Soon after someone dies, the body starts to go through natural changes. Two main processes cause these changes: putrefaction and autolysis. Which one happens more and how fast depends on things like the climate, the weather, where the body is, and how the person died. Putrefaction is what most people think of when they imagine a body decomposing. I don't know if any of you have ever looked at anything to do with the Body Farm, where they study all of these changes in depth. Putrefaction is caused by bacteria, especially from the gut, spreading throughout the body once it stops working. These bacteria create gases and break down tissue, which leads to a greenish colour that starts on the lower right side of the belly, swelling or bloating, skin slipping off, and a strong, unpleasant smell. This tends to happen a lot faster in warm, moist climates. Autolysis is when the body starts to break itself down using its own chemicals and enzymes, especially in organs like the pancreas and the stomach. This happens more in dry, hot conditions and can sometimes lead to mummification if the environment is right. Usually, both processes happen at the same time. In average climates, they can break down the body fairly quickly. These changes can make it harder for a pathologist to see some of the details during an autopsy, but they don't stop the autopsy from being useful. So for those questioning why lupus doesn't show up in Shanann's autopsy, there is a medical reason for that. Because of autolysis, the immune system markers doctors would normally test for are no longer reliable. Blood cells break down and the samples get contaminated. The tissues change too much. So the tests needed to confirm lupus can't be done reliably after death because the body's own breakdown process destroys the evidence. As I said, more on lupus in a short while. So, post-mortem blood from the spleen, they found ethanol, alcohol, to a level of 128 milligrams per decilitre. Shanann had a blood alcohol concentration, a BAC or BAC, of 0.128 grams per 100 mils of blood. The blood taken from the spleen after death showed an alcohol level of 0.128%. A reading like 0.128 grams per 100 millilitres might immediately suggest alcohol consumption before death. But when the body has begun to decompose, things aren't always so straightforward. In fact, this level could be entirely the result of post-mortem changes, specifically a process called endogenous alcohol production. So let's break that down. After death, the body begins to decompose. A biological process known as putrefaction, which we mentioned earlier, is the stage that is driven by bacteria and enzymes breaking down the body's tissues. And during this process, the body can actually start producing alcohol internally without the person ever having drunk it. This endogenous alcohol production is something forensic toxicologists are trained to look for. Studies have shown that during decomposition, ethanol, the same type of alcohol that's found in beer, wine, and spirits, can be produced by the bacteria and yeast naturally present in the body. In fact, in some cases, postmortem backs as high as 0.20% have been recorded in individuals who had no alcohol in their systems before death. So a back level of 0.128%, while it might raise eyebrows, isn't outside the range of what can be naturally produced after death, particularly under certain conditions. And several factors influence how much alcohol might be produced in the body after death. There's the temperature. Warmer environments speed up decomposition, which can lead to faster alcohol production. There's humidity and burial conditions. Being buried in moist soil or exposed to rain can influence microbial growth. There's a time since death. The longer the body is left before being found, the more time bacteria have to generate ethanol. And then there's body positioning and fluid retention. If fluids pool in any part of the body, they can encourage fermentation in those areas. All of these elements can create a false positive blood alcohol concentration reading or cause a real reading to appear much higher than it was at the time of death. And this really matters. This is why toxicologists don't just look at the number, they look at the context. If a body has already started decomposing, as was the case here, a blood alcohol concentration of 0.128% could be caused by post-mortem ethanol production, not actual drinking. To make accurate conclusions, forensic experts will look for other signs of alcohol in the body, such as whether alcohol is present in the vitreous humour, which is the fluid in the eyes, because that's less prone to decomposition. They'll look for the presence of alcohol metabolites, like ethyl glycuronide, and whether alcohol appears uniformly through the body or only in one location. Ultimately, a back at this level might suggest drinking before death, but if decomposition has begun, it is more than plausible that the alcohol is a result of natural processes that occur after death. This is why it is so important not to jump to conclusions based on numbers alone. In forensic science, context is everything, and that is something that we as bystanders often miss. We weren't at the autopsy. We often don't understand a lot of this medical jargon that's used in autopsies. And so we just have a number and we see a number and we do a quick Google search for, is this blood alcohol concentration level high? And Google may tell us that it is and start informing us that the person must have been drinking. And so away we go. But we have to look at the whole thing, the whole report. Now, Shanann's friends were interviewed, which is available to look at in the Discovery, and law enforcement were asking if Shanann had been drinking in Arizona, or if she may have been drinking when she returned home, and whether she was a big drinker in general. That wasn't necessarily because they were suspicious about her, but just because they were doing their job. There is a finding from an autopsy here, and it is their job to investigate it. I see this a lot. Well, the police were so concerned about Shanann being an alcoholic that they checked with all of her friends. There's no documented evidence that Shanann was an alcoholic. Those that say she didn't have lupus because there's no organ changes which point to lupus in the autopsy report miss the fact that when they go on to say she was a raging alcoholic, there was also no visible changes to the liver or any other organs that would be a direct result of being a raging alcoholic. So we do have this constant level of hypocrisy running through this case with people and certain opinions that they hold about things. And of course, opinions are absolutely fine, but it's when the opinions start trying to portray victims of horrendous crimes in a bad light that I really do have a problem with, and that level of misinformation does need to stop. We're going to have a little look at the autopsies of Celeste and Bella, and then we're going to move on to taking a look at lupus, the other testing that could have been done but wasn't able to be done due to Shanann's level of decomposition, and some broader information about prolapse and coffin birth. This is really sensitive material. We are now moving into the autopsies of two very young children. We're going to start off with the toxicology report for Celeste, which reveals important findings about what substances, if any, were present in the body at the time of death. But as we've discussed before, in cases where the body has already started to decompose, interpreting these results isn't always black and white. So let's try and break it down in simple terms. The first test is a basic toxicology panel on blood drawn from the spleen, since regular blood samples often degrade after death. The result? None detected. That means no common drugs like opioids, benzodiazepines, or other controlled substances were found in this test. We do have hydrocarbon and oxygenated volatiles present in the spleen blood. And this is where things get more interesting. This panel looks for volatile chemicals, including alcohols that may appear either before death or as a result of decomposition. And here's what was found. N-butanol, 4.4 micrograms per milliliter. Ethanol, 31 milligrams per deciliter, which equals a back reading of 0.031%. N-propanol was present, and acetaldehyde was also present. So let's pause here and explain what that means. Ethanol, as we know, is the type of alcohol found in alcoholic drinks. N-propanol and N-butanol are not from drinking. They are byproducts of bacterial activity. And acetaldehyde is another breakdown product that forms when the body or bacteria metabolize ethanol. So what does this suggest? These findings point strongly towards post-mortem production of alcohol. Again, as in Shanann's case, I highly doubt that Celeste had been drinking alcohol before her death. The presence of N-propanol especially is a red flag for decomposition-based alcohol, since this compound rarely shows up in living people. The liver was also tested for alcohol, and the results showed something unusual, hence the section for ethanol in liver tissue, see comment. At first, the liver tissue had 99 milligrams of ethanol per 100 grams. Later tests on the same sample showed 174 milligrams per 100 grams. In simpler terms, the ethanol levels increased over time in storage. That's not actually supposed to happen unless fermentation is occurring in the sample, meaning the alcohol is being produced inside the tissue after the sample was collected. The toxicologist notes that the container used might not have contained a preservative, which would allow bacteria to continue breaking down tissue and creating alcohol even after the sample was in the lab. So what does it all mean? Well, the low blood alcohol content level could be within the margin of decomposition-related alcohol production. The presence of N-propanol, butanol, and acetaldehyde all suggest bacterial fermentation, not alcohol consumption. The rise in alcohol levels in the liver sample are another clear sign that post-mortem activity, not ingestion, is likely responsible. So while toxicology technically detected alcohol, there's no conclusive evidence that Celeste had been force-fed alcohol. Instead, this appears to be just another example of post-mortem alcohol synthesis, which can mislead investigations if not carefully interpreted, and of course has led to some people theorising that either Chris or Shanann had made Cece drink alcohol ahead of her death. Now let's take a closer look at N-propanol. It's a chemical that often comes up in toxicology reports, especially in post-mortem analyses. So what is N-propanol? Well, it's a type of alcohol, but not the kind you drink. Instead, it's mostly used as a solvent in industries like cleaning products, paints, and manufacturing. N-propanol is not typically found in oil field tanks. Oil field tanks are primarily used for storing crude oil and produce water, not chemical solvents like N-propanol. When we find N-propanol in a postmortem toxicology report, it usually signals those postmortem bacterial activities rather than ingestion. This is really important because the presence of N-propanol often suggests decomposition processes producing alcohols after death, rather than the person having consumed these substances before dying, which is something that a fringe group of people do like to say, that Cece and Bella were force-fed alcohol by their parents. And it clearly shows up in the autopsy reports in the form of N-butanol. So the presence of N-butanol, along with other higher alcohols like N-propanol, can suggest that ethanol is being produced post-mortem by microorganisms. And this is because microorganisms can ferment sugars and carbohydrates, producing ethanol and other alcohols like N-butanol. In an autopsy report, acetaldehyde is primarily investigated in relation to the possibility of post-mortem ethanol generation. Elevated acetaldehyde levels in blood, particularly exceeding 0.014 grams per deciliter, can suggest that ethanol was produced after death, potentially complicating the interpretation of pre-mortem blood alcohol levels. Acetaldehyde is also a toxic metabolite of alcohol and is also involved in processes like fibrogenesis in the liver. There's no really easy way to explain any of this as just a regular layperson. As I said, I'm not a professional, but the basic upshot of it is that the N-butanol, the N-propanol, and the acetaldehyde that were found in Cece's blood were byproducts of decomposition, not her being abused in any way, shape, or form, and these being trace elements of that abuse. Let's move on to the actual autopsy, and we'll start with the background. The decedent was a 3-year-old Caucasian girl born on July the 17th, 2015. Her medical history included a known peanut allergy. We'll move on to this later as well, because this is another bone of contention for some. On the afternoon of August the 13th, 2018, she was reported missing along with her mother and sister. Tragically, she was later found unresponsive, clearly deceased inside an oil tank battery located on rural property. She was officially pronounced dead at the oil field at 3:40 p.m. on August the 16th, 2018. At the time of the autopsy, rigor mortis, the stiffening of the muscles after death, had already released in the major muscle groups, including the muscles used for chewing. Livor mortis, which is the pooling of blood after death, was not clearly visible due to changes caused by the post-mortem process. The body showed mild signs of decomposition, including general bloating, areas of marbling or mottled skin discoloration, and skin slippage, where the outer layers of the skin begin to separate. In fact, during the washing of the body, most of the skin peeled away. Looking more closely, the hair on the head was red-brown, normally distributed and about 15 centimetres long on top. The eyes were cloudy, which is a common post-mortem change. The irises appeared brown and the pupils were equal in size, measuring about 0.3 centimetres. The whites of the eyes looked dull, but there were no small pinpoint hemorrhages known as petechiae on the eye surfaces. The nose was centred and intact, showing no damage when touched. Inside the mouth, the natural teeth were present and in good condition, with no signs of bleeding on the inner cheek lining. The neck structures were centred and showed no swollen lymph nodes, and the chest showed normal female breasts and nipples without abnormalities. Moving to the abdomen, it was mildly swollen and tense, which is common after death and considered a post-mortem artefact. No unusual fluid movement or waves were detected when examined. The external genitalia were identified as normal female. Looking at the limbs, the upper limbs were well developed and symmetrical, however the palm surfaces of the hands had been sloughed off before recovery and were packaged separately. These palm surfaces, along with the fingers and fingernails, were collected and sent to the Colorado Bureau of Investigation for further examination. The lower limbs were also well developed and symmetrical, with all toes intact. The toenails appeared short, slightly dirty, but otherwise in good condition. The back and sacrum showed no unusual findings and appeared normal. The internal examination began with a standard thoracoabdominal incision, and this is one of the most common incisions used for opening the thoracic and abdominal cavities. At the level of the belly button, the layer of fat under the skin measured about 1 centimetre thick. Within the body cavities, no abnormal collections of fluid or adhesions were found. However, the internal organs showed noticeable discoloration and areas of breakdown consistent with postmortem changes. Regarding the heart and circulatory systems, the heart weighed 80 grams and appeared normal on the outer surface. The coronary arteries, which supply blood to the heart muscle, were opened and followed a typical pattern with no significant narrowing or blockages. There was no evidence of recent blood clots. Inside the heart lining and muscles were normal, firm, and without any scarring. The heart valves were thin and flexible. The aorta, the main artery leaving the heart, had a smooth and normal inner surface with only minimal early signs of artery lining changes. Major arteries branching off the aorta, such as those supplying the stomach, intestines and kidneys, were wide open. The inferior vena cava, the major vein returning blood to the heart, was unremarkable. Moving on to the respiratory system, the right lung weighed 180 grams and the left lung 160 grams. Both lungs showed normal internal divisions called septa, and these are like thin connective tissue walls that divide the lung into the smaller units that medical professionals call lobules. The septa are actually crucial for lung structure and function, particularly in gas exchange. The lung tissue appeared dark pink to purple and was significantly collapsed, which is a condition known as atelectasis. Just to add, as well as often occurring due to decomposition, smothering can cause atelectasis. When a person is smothered, the blockage of airways, either by a foreign object or pressure, can lead to the lungs collapsing or not inflating properly. There were no tumours or large areas of lung infection or consolidation. The windpipe and main airways were normal with no foreign objects or growths. The arteries in the lungs were free of blood clots. And if we move on to the spleen, it was soft, it weighed 40 grams, and it had a smooth, shiny outer covering called the capsule. The internal tissue was firm, red purple in colour and smooth with no signs of injury, scars or cysts. Next, the liver and biliary system. The liver weighed 320 grams and had an intact outer covering. The liver tissue was firm and red-brown with no masses found. The gallbladder had a thin wall and was empty. Examining the gastrointestinal tract, the esophagus, the tube connecting the throat to the stomach, was uniform in size and had healthy lining. The stomach was empty. Its lining was smooth, shiny, and showed normal folds called rugae. They're commonly known as gastric folds, and they're like the ridges that are found on the inner lining of the stomach. They're formed by the mucosa and submucosa layers, and they allow the stomach to expand when it fills with food. No ulcers were found in the stomach or the first part of the small intestine, and both the small and large intestines looked normal in size and appearance with the appendix present. The pancreas appeared tan orange and showed normal lobular structure. There were no signs of bleeding or tissue breakdown. The adrenal glands located above the kidneys had a golden outer layer called the cortex and a grey-brown inner layer called the medulla, both appearing normal. The renal cortex, the outer layer of the kidney, is a critical part of the kidney structure and function. It's responsible for filtering blood, reabsorbing vital nutrients, secreting waste, and regulating blood pressure. The medulla is the inner part of the kidney, and that plays a vital role in regulating urine concentration and other crucial kidney functions. Finally, the genitourinary system. The right kidney weighed 50 grams and the left kidney 40 grams. The outer capsules peeled off easily. The outer cortex of the kidneys was red, purple and smooth, clearly separated from the inner medullary areas. The kidney pelvises and tubes leading to the bladder were not enlarged. The urinary bladder was empty with a tan pink, moist and smooth lining. The female internal reproductive organs, cervix, uterus, fallopian tubes and ovaries showed no abnormalities, and there were no areas of concern. Moving to the neck, the front muscles appear smooth and shiny. The epiglottis, which helps protect the airway during swallowing, and the hypopharynx, part of the throat, look normal. The hyoid bone and the thyroid cartilage, key structures in the neck, are intact. The lining of the voice box, or laryngeal mucosa, is purple-pink, moist and smooth, with no unusual growths or inhaled material present. The thyroid gland is symmetrical and shows no abnormalities. Moving to the spine, the spinal column has a normal shape and alignment. Next, the skull and brain. When the scalp is lifted, there are no cuts, bruises or blood collections found. The skull itself is intact with no fractures. The tough membrane covering the brain, called the dura, is unbroken with no bleeding underneath it. There is also no bleeding in the spaces around the brain. The brain is notably soft and swollen, which is expected after death and is called postmortem artifact. It weighs 1,280 grams, which is within normal range. The brain's blood vessels appear normal. The cranial nerves, which control many vital functions, are symmetrical and intact. Detailed slices through the brain show no bleeding, bruising or tumours in the outer layer, inner white matter, brainstem or the cerebellum, the part responsible for balance. Finally, the joint between the skull and the spine, called the atlanto-occipital joint, is intact and the neck has normal movement. At the time of the autopsy, several specimens were collected for further testing. These included pooled blood from the iliac veins and heart, blood from the spleen, and samples of liver tissue. Iliac veins are blood vessels in the pelvis that carry oxygen-poor blood from the lower body back up to the heart. For toxicology analysis, the pooled blood, spleen blood, and liver tissue were sent to NMS laboratories. For microscopic examination or histology, small sections of the heart, lung, liver, kidney, and brain were collected and submitted. Additional evidence gathered includes swabs taken from the face and front of the neck, both before and after washing the body, and swabs were also taken from both palms, the oral cavity, and the vaginal area. Skin and fingernail samples from both hands were collected as well, and a DNA blood spot card was also prepared. Full body x-rays were performed and the images were submitted to the Weld County Coroner's Office. Under microscope, tissue samples from the heart, lungs, liver, kidneys and brain all showed no signs of disease or abnormalities. Let's move on to Bella. The official diagnoses from the autopsy report are as follows. First, the decedent had a history of being reported missing and was later found deceased inside an oil tank battery. The cause of death was determined to be asphyxiation due to smothering. There was evidence of blunt force trauma to the frenulum and the gingival mucosa of the upper jaw, indicating some form of physical injury prior to death. Postmortem changes related to decomposition were noted, which are common and expected in cases where the body has been exposed to the environment for some time. The stomach contained oil, water, and sludge debris, consistent with the environment where the body was found. In addition, there was confirmed hydrocarbon exposure identified. Toxicology results showed no substances detected in basic liver tissue analysis. However, analysis of blood from the chest cavity revealed the presence of several hydrocarbons, including benzene, ethylbenzene, toluene, measured at 3.7 micrograms per milliliter, xylenes, including ortho, meta, and para isomers, N-hexane, methylpentanes, and N-butanol. Additionally, ethanol was detected at a low level of 13 milligrams per deciliter, and acetaldehyde was also present. Benzene can be present in oil field tanks as it's a natural component of crude oil. The concentration of benzene in crude oil varies depending on factors like geological conditions and the age of the oil field. Ethylbenzene, a flammable, colourless liquid with a quite sweet odour, is often found in petroleum-based products, including gasoline, and might be present in oil-filled tanks. Toluene is naturally present in crude oil and is a component of gasoline. Xylene, also known as xylol or dimethylbenzene, is a colourless, flammable liquid with a sweet odour. It's a solvent and is used in various industries like printing, rubber, leather, and cleaning. Xylene naturally exists in crude oil and is also produced commercially from petroleum. N-hexane, a naturally occurring component of crude oil and natural gas, is also a constituent of heating and motor fuels refined from petroleum. It is a highly volatile, flammable liquid that can be present in oil-filled tanks during storage and handling of petroleum product. Methylpentane, also known as isohexane, is an alkane that can be present in oil-filled tanks, particularly in the context of crude oil storage and processing. It's a volatile organic compound, or a VOC or VOC, that can be found in crude oil and is a component of gasoline. So these things found in Bella's system do make sense based on the location of where her body was recovered. There were several injuries seen on the outside of Bella's body. On the left buttocks, there was a long scratch, about 13 by 3 centimetres. Inside the mouth, there was a cut at least 1.5 centimetres long on the small piece of tissue called the frenulum and the upper gum, with nearby bruising that looked pink and purple. There were also some shallow bite marks on the tongue. On the left side of the body, there was a yellowish scrape about 9 by 4 centimetres and a smaller, faint yellowish spot on top of the left shoulder. No injuries were found inside the body. The full exam started on August 17th, 2018 at 1:30 p.m. at McKee Medical Center in Loveland, Colorado. The body of Bella Watts is described as well-grown and healthy-looking white girl who was about 4 years old. She was about 41 inches tall and weighed 38 pounds. At the time of the exam, the stiffening of the muscles after death, rigor mortis, had gone away. The settling of blood after death, livor mortis, wasn't easy to see because the body had already started to break down. The body showed signs of decomposition like swelling, discoloration of the skin, called marbling, and the skin was peeling off. This was worse because the body was found in an oil tank, which caused a lot of the skin to come off when washed. The hair was blonde brown, spread normally on the head and about 15 centimetres long on top. Her eyes were cloudy because of changes after death. The coloured part of the eyes was brown and the pupils were equal and small. The white part of the eyes looked dull but had no small spots of bleeding. The nose was straight and normal. The mouth had natural teeth in good shape, but the tissue under the tongue was badly damaged and bruised. There were also bite marks on the tongue. The neck looked normal with no swollen lymph nodes. The chest showed normal female breasts. The belly was a little swollen and tense, which is normal after death, and the outside female genitalia looked normal. The arms and legs were well developed and even. All fingers and toes were present. The fingernails were short and a bit dirty, but not torn. The fingernails were cut and saved as evidence. The toenails were also short and a little dirty, but in okay condition. The back and lower back area looked normal. The body was opened using a standard cut through the chest and abdomen. The fat layer under the skin near the belly button was about 1.2 centimetres. Inside the body, there was no unusual fluid buildup or any sticky bands between the organs. Moving to the heart and blood vessels, the heart weighed 80 grams and looked normal on the outside. The main openings of the coronary arteries, which supply blood to the heart muscle, were clear. The arteries followed a normal pattern, and when cut open, there was no significant narrowing or blockage from hardening of the arteries. There were no blood clots. The inner heart walls and muscles looked normal. The heart itself was firm and healthy with no scarring. The heart valves were thin and flexible. The main artery from the heart, the aorta, had a smooth and normal inner surface with only very minor signs of early artery hardening. The major arteries branching from the aorta were open and working well. The large vein carrying blood back to the heart, the inferior vena cava, looked normal. Onto the lungs. The right lung weighed 160 grams and the left 140 grams. The lung tissue was properly divided into sections, as expected. The lungs looked mottled, with colours ranging from pinkish to purple, which is normal after death. There were no lumps, solid areas or signs of infection. The windpipe and main airways were normal, with no foreign objects or masses. The lung arteries were free of any blood clots. Looking at the spleen, it was soft and weighed 60 grams. Its outer covering was smooth and shiny. The inside tissue was firm and red-purple in colour, and there were no areas of dead tissue, lumps, scars or cysts. Onto the liver and gallbladder. The liver weighed 350 grams and had a smooth outer layer. The liver tissue was firm and reddish-brown with no lumps or tumours. The gallbladder was thin-walled and empty. Moving to the digestive tract, the esophagus had a normal size and healthy lining. The stomach contained about 75 millilitres of thick, greenish-black fluid. This fluid likely came from the oil and dirt inside the oil tank where the body was found. The stomach lining was smooth and folded normally. There were no stomach or duodenal ulcers. The small and large intestines were normal in size and appearance, and the appendix was present. In terms of the other organs, the pancreas was tan orange and showed normal lobes. There were no signs of bleeding or fat breakdown. The adrenal glands had a golden outer layer and a grey-brown inner part. For the kidneys and urinary system, both kidneys weighed 50 grams each. Their outer coverings came off easily. The outer part of the kidneys was smooth and reddish-purple, and the boundary between the outer and inner parts was clear. The kidney tubes and ureters were not swollen. The urinary bladder was empty but had a normal pink moist lining. The female reproductive organs inside, including the cervix, uterus, fallopian tubes and ovaries, looked normal. Onto the neck and throat. The front neck muscles were smooth and shiny. The epiglottis, that flap that helps direct food and air, and the lower throat area looked normal. The hyoid bone and thyroid cartilage were intact. The lining of the voice box was pinkish purple, moist and smooth, with no lumps or food material in the airways. The thyroid gland was normal in size and shape. The spine was shaped normally. Moving to the skull and brain. When the scalp was lifted, there were patchy dark spots called tardieu spots. Yes, I understand my French sucks. That showed small collections of blood just under the skin. Tardieu spots, also known as hyperstatic hemorrhages or postmortem petechiae, are small hemorrhages that can develop on the skin, including the scalp, after death. And they're caused by the rupture of capillaries due to the pooling of blood in dependent areas after death, particularly when there's been intense lividity or liver mortis. Tardieu spots are a post-mortem change, and they're not indicative of any particular cause of death, including strangulation. However, they can be confused with petechiae in cases of strangulation, which are also small hemorrhages. There were no bruises on the scalp. The skull was intact without any fractures. The protective layers around the brain were intact with no bleeding on or inside them. The brain was swollen and soft, showing flattened ridges and narrowed grooves, which is common after death. The brain weighed 1,300 grams. The blood vessels in the brain looked normal, and the nerves coming from the brain were all symmetrical and intact. Sections of the brain showed no bleeding, bruises or tumours in any part, including the brainstem and cerebellum. The joint between the skull and the spine was normal, and the neck bones moved normally. During the autopsy, samples were collected from the clear fluid inside the eyes, called the vitreous fluid, and blood from veins in the arms, heart and lungs. The combined blood samples and liver tissue were sent to NMS labs to test for drugs, poisons or chemicals. Small pieces of the heart, lungs, liver, kidneys and brain were taken to be looked at under a microscope, and evidence was collected including swabs, cotton samples taken from the face and the front of the neck both before and after the body was washed, swabs from the palms of both hands, mouth swabs, vaginal swabs, fingernail clippings from both hands, and a blood spot card for DNA testing was done. Full body x-rays were done and sent to the local coroner's office for review. And when examined under the microscope, the heart, lungs, liver, kidneys and brain all appeared normal with no disease or injury detected. Moving to Bella's toxicology report, because this gets a lot of attention. And I'm just going to pop something up on the screen for a minute. So the actual autopsy report's going to disappear just while I show you guys this. We're just trying to understand reporting limits in toxicology. When we look at a toxicology report, it can be really alarming to see substances listed, especially in a case involving a child like Bella Watts. But here's something really important that many people misunderstand. Just because a substance is listed doesn't mean it was present in a significant or harmful amount. Toxicologists work with incredibly sensitive instruments that can detect even the tiniest trace of a substance. Sometimes so tiny, it's below what's called the reporting limit. The reporting limit is like a cut-off line. If something is detected below that line, it's so low that it may not be scientifically meaningful. In other words, it's probably just background noise, not a sign of drug use, poisoning or foul play. In Bella's case, there were trace detections, possibly things like alcohol, metabolites or breakdown products of common substances, but the toxicology report usually makes clear when a level is below the reporting limit, not enough to indicate poisoning, or consistent with normal decomposition. Also important, after death, the body naturally breaks down and this can create chemicals that resemble drugs or alcohol. This is the postmortem artifact that we've been talking about. So even if a tiny trace of something like ethanol, alcohol, shows up, it could have come from the body decomposing, not from the person consuming anything. Now, I think we've got on track with that throughout this, but I have made a little visual chart as best as I can make a little visual chart so we can try and see with our eyes what exactly is going on in Bella's toxicology. So as you can see on here, I've got the chemical down the very left-hand side. The next column in is the detected amount in micrograms per milliliter. The column after that is the reporting limit. And the last column on the far right is the status. So whether it's above or below that reporting limit. And we can see that when we look at it visually in a table like this, there's only two things listed above the reporting limit: toluene and ethanol. All the other things that we see being tested, amphetamines, cocaine, all of that stuff, people have looked at these results, seen the number and gone with the idea that that's the amount of substances that was actually found in the bodies of the victims. But this is just standard drugs testing that's done in a toxicology report. And the numbers that we're seeing, they're the reporting limits. The important thing to look at in all of these autopsies is the actual findings section of the toxicology report, because that is what shows what exactly was present, what substances were above the reporting limit, because that's all that matters. None of these other drugs were listed in any of the victims' toxicology findings. Not one. Again, I'm not a professional, but this is what I understand from reading some really scientific books. I have linked to all those in the description of this video so you can see the materials that I've used, and I'm not just making it up off the top of my head. Now, the toxicology labs use standardized reporting limits that are usually based on instrument sensitivity, so how low a level the machine can detect reliably, national or lab-based guidelines, because they do differ from place to place, and the matrix tested, which is whether blood has been tested, liver's been tested, tissue's been tested. You get the idea. The source for this is Baselt's Disposition of Toxic Drugs and Chemicals in Man, and that was the 11th edition for anyone who's interested in a bit of further infuriating reading. Hopefully that makes a little bit of sense to you. I know that people do often go, oh my gosh, look, it says that's detected. And I've seen people breaking down the autopsy reports where they're saying, well, there's propranolol in her system, and propranolol's a beta blocker and it can be used as an antidepressant, and people were drugged and all of this kind of stuff. It doesn't say propranolol, it says N-propanol. And there's a massive distinction between the two. But this is what happens sometimes when something is misrepresented and it gets into the hands of people who don't fact check the information that they've just taken in, and they spread that information. And then we have a huge problem because people are saying, well, they were shoveling antidepressants down their children's necks, or Shanann was off her face on propranolol and all these other antidepressants. It's not accurate, it's not fair, and it's certainly something that needs to be corrected if we do see it out there in the great wide world. I am just going to take a second to apologise here because I am actually coming down with a bit of a cold, and I can feel my voice is getting rougher and raspier by the second, so I hope it's not too unbearable. I'm shoveling in strepsils as we speak. One of the main problems for people with this autopsy report, as I said, is lupus. Did Shanann Watts really have lupus? In the years since the Watts family tragedy, this one question keeps coming up and up and up, and often unfairly. Some people point to this autopsy and say the autopsy does not state she had lupus. Others question why she was posting photos of herself sunbathing or didn't appear to have the classic butterfly rash associated with the illness. So today, let's just address these claims head on, using facts, medical understanding, and a little bit of compassion. Lupus, formerly called systemic lupus erythematosus, or SLE, is a chronic autoimmune disease where the immune system attacks the body's own tissues. It can affect the skin, the joints, the kidneys, the brain, the lungs, and more. It can do a lot of damage. But here's what many people don't realise. Lupus is often called the great imitator because its symptoms vary so widely between individuals. One person might have severe, visible symptoms, while another may have subtle or invisible ones, and those symptoms can come and go in flares. I have something similar to lupus. It isn't lupus, but it is that kind of occasionally invisible illness, depending on whether I'm having a flare-up or not. And sometimes these things that attack our immune systems, they're really, really difficult to diagnose, and they're just as difficult to explain because it can cause such wide range symptoms. They're often overlooked as being just one thing. With lupus, doctors are looking for symptoms like fatigue, joint pain or swelling, skin rashes, and especially the butterfly rash, which is normally kind of seen over the bridge of the nose and extending out onto the cheeks. They're looking for mouth ulcers, especially mouth ulcers that don't heal too well, chest pain when breathing deeply, photosensitivity, hair loss, fevers without infection. There's a whole load of other things that can come in with lupus. You can get scleroderma and Raynaud's phenomenon, so you can have issues with your circulation. I'm not going to go into every single symptom, but you are getting the point here that so far the symptoms are a little bit wide-ranging. Because lupus mimics many other conditions, pattern and persistence of symptoms are key for doctors. Without them, they're going to struggle to even think that you might have lupus, at least here in the UK, but that's because generally our doctors can be horrendously bad. No single test can diagnose lupus. It's not as easy as just having one blood test done or one scan done and sent off for evaluation. But some of the common tests that people do have for lupus include ANA testing, which is anti-nuclear antibody tests. And most people with lupus test positive for ANA, but a positive ANA alone doesn't actually confirm lupus. It is also possible for people who do have lupus to not test positive for ANA. Anti-dsDNA and anti-Smith antibody testing can be done. They're much more specific to lupus, but not everyone with lupus will test positive for these. ESR or CRP tests can be done, your standard blood tests that check for general inflammation. And urinalysis can be done, which might show some kidney involvement, like protein or blood in the urine. Lupus often does attack the kidneys, and too much protein or blood in the urine can be an indication of lupus. Doctors often use criteria from the American College of Rheumatology, the ACR, when they have a patient displaying lupus symptoms. A patient has to meet a certain number of criteria from the symptoms, lab results, etc., to actually be classified as having lupus. They can't just have one or two things. They have to have multiples. There needs to be specific symptoms and there needs to be specific lab findings. Because lupus symptoms do overlap massively with other illnesses like rheumatoid arthritis, fibromyalgia, or things like Lyme disease, diagnosis often involves ruling out other explanations. So it can be a really long journey for someone to get diagnosed with this condition. Lupus is usually diagnosed by a rheumatologist, a specialist in autoimmune and inflammatory diseases. And as I said, it's hard. It can take months or even years to get a definitive diagnosis due to how unpredictable and varied the symptoms are. And that's one reason why patients like Shanann may have had to advocate strongly for her diagnosis and treatment, especially when the disease is often invisible to others. But why did lupus not show up in Shanann's autopsy when she claimed to have it, and it causes all of these symptoms? Well, an autopsy isn't actually designed to diagnose every single chronic condition that somebody lived with, only to identify what contributed to the cause of death. Lupus might show signs at autopsy if it caused organ damage, like scarring in the kidneys or scarring in the lungs. But if the disease was mild, or if it was well managed, or simply just not flaring up at the time of death, the pathologist might not find any trace at all. And unless it contributed to death, the medical examiner has absolutely no obligation to include it in the report. So Shanann's autopsy not mentioning lupus certainly doesn't mean that she didn't have it, just that it wasn't medically relevant to how she died. So those that believe Shanann faked lupus because the autopsy doesn't mention it, they're missing or ignoring a really valuable piece of information from the autopsy itself. The line that says, "Full microscopic examination was not possible due to decomposition." That means the very tests that might have confirmed lupus-related inflammation, like kidney biopsies, lung tissue analysis, or detection of immune complex deposits, couldn't be performed. Lupus often requires microscopic or immunological testing to be confirmed at autopsy, and that was just not feasible in Shanann's case. They ask, why did the medical examiner mention the gallstone then, if they're not required to report on everything? Well, he was doing a physical examination. He's having to look at the gallbladder. There's a stone in the gallbladder, so he's going to mention that because he's physically seen it. What he can't physically see is any trace of an autoimmune disease when the further testing can't be done, because not everybody will suffer from organ damage. Another thing that I do see a lot is, why was Shanann in the sun? Why was she always on holiday in a bikini and in the sun? Doesn't that prove that she's faking having lupus? Well, here's the truth on that one. Not all lupus patients are photosensitive. While up to 70% of people with lupus do experience increased sensitivity to sunlight, a massive 30% don't. Even among those who are photosensitive, reactions really vary. Some get rashes, some get fatigue or flares after exposure, and some learn to tolerate short periods in the sun using SPF, hats, or protective clothing. We don't know when these photos were taken. They might not have been taken when the sun was at its hottest. And brightest, we don't know how long she was outside or whether she had a reaction afterward. Judging someone's medical truth based on some social media images really isn't just unfair, it's medically inaccurate. We then ask, where's the butterfly rash? Absence of this rash proves that Shanann did not have lupus. Well, the so-called butterfly rash, the facial rash that appears over the nose and radiates out onto the cheeks, it only appears in about half of lupus patients. Not all. Even for those who do get it, it doesn't show up all the time. It can appear during a flare-up and it can fade when a person's in remission. So not seeing it in photos or during the autopsy proves absolutely nothing. So why did Shanann say she had lupus? Have we ever stopped to think that that's because she likely did? She spoke openly about a diagnosis long before the murders, and anyone living with lupus knows how hard it is to navigate everyday life with fatigue, joint pain, and the unpredictability of flares. She had no clear reason to fake it, and publicly sharing health struggles is often a way to raise awareness and connect with others. Some say that she didn't suffer any hair loss. They go on to say after that her hair was thin and horrible and in really bad condition, and why did she not do something to thicken it up? Well, lupus affects the hair. One of the common symptoms of lupus is hair thinning or patchy hair loss, and this can be due to inflammation caused by the disease itself or from lupus medications. And that hair loss can be temporary or permanent depending on the severity and the type of lupus. Lupus flares, or the stress of illness, can trigger a condition where the hair follicles prematurely enter the resting phase, which means that your hair constantly sheds. All you need to do is put your hand to your head and you will shed everywhere. Some lupus treatments, like chemotherapy drugs, corticosteroids or immunosuppressants, they can cause hair thinning or loss. And lupus can affect the hair texture, making it brittle and dry, which might cause hair breakage. It's so easy to say Shanann didn't have lupus because her hair wasn't falling out, yet continue to fuel these kind of hate narratives by picking at how her hair looked and referring to it as too thin and in bad condition. Shanann clearly had some insecurities over her hair because she mentions it frequently in her live videos. She often says, "My hair is a mess," or "Sorry guys, my hair just won't do what I need it to do." She likely had these insecurities because lupus had damaged her hair. The thing I see the most is she definitely didn't have lupus because the autopsy would definitely have reported major organ damage. And this sometimes comes from people who say they have lupus themselves. So I don't actually understand how they can use their own condition as almost a weapon against a deceased lady in some circles. This isn't everybody who has lupus comments. I mean, in those dark, nasty areas of the internet where we literally pull deceased people to pieces for how they looked. I just find it quite terrible. As I said, my condition is very similar to lupus, although it isn't that, but I have a lot of the symptoms of lupus. And if I come across somebody with my condition, I wouldn't be saying to them, well, it's like this for me, so you're lying, you don't have that. That is just wrong. How have we even got to that point? Although I don't have lupus, my sister has lupus, as does my best friend. My sister absolutely can't tolerate heat for even 5 minutes. It's a nightmare for her. She breaks out in lumps and bumps and she gets a face rash. Her lupus is considered mild, so she's treated by oral medication only. Now her hair is really thin and she's lost patches of it. My best friend was diagnosed when she was 14 years of age, which is really quite young to get a lupus diagnosis. She gets full-on infusions at the hospital every few months with cancer treatment drugs, as well as having to take a whole host of oral medications for all of the associated conditions that she has alongside the lupus. She's 38 years old now. She is constantly sick with one germ or another, and honestly, she was a huge source of concern during the COVID lockdown. She has gorgeous long hair, shiny, beautiful condition, and she's never experienced any hair loss. She's never had a butterfly rash, and her favourite hobbies are going on holiday abroad to the beach, and she loves to sunbathe in utterly ridiculous heat. It doesn't affect her too much, other than cause fatigue and a bit more pain in her joints, which she says is actually worth it for the holiday experience. She says she still has a life to live after all. You can see the difference here. Two people with the same condition, yet both react differently to it. Both suffer differently and both have different limits. Just because my friend can go out in the sun doesn't mean to say she doesn't have lupus. We only saw what Shanann posted on her social media. We don't know if she suffered from the heat, and we don't know how she behaved when the camera was off. She might have posted a lot, but we still only have a snapshot of her life compared to actually being around her physically and witnessing how she lived for ourselves. But I am going to play devil's advocate now, because I said I'd be approaching my cases from all angles. So, what if Shanann didn't have lupus? What if she lied? This is not to say that Shanann did this, but just to examine what motivates false illness claims in general, which used to be a really rare occurrence, but is on the up and up over the years. There's often a need for validation or attention, so this is a psychological problem. Some individuals with undiagnosed mental health issues might seek attention or care by exaggerating or fabricating illnesses. This, in its most extreme, can be linked to a condition called factitious disorder, which is formerly Munchausen syndrome. Factitious disorder is extremely rare, and it shouldn't be assumed lightly. Sometimes people who fabricate an illness do it to build a brand or a community identity. Shanann was active in selling Thrive through Lavelle, and that's a health and lifestyle MLM. In online wellness spaces, people sometimes share personal health stories to build trust or reliability. It's possible that some viewers question whether her story was exaggerated to sell the product or create a narrative to draw people in. Sometimes people get misdiagnosed by GPs, doctors. It happens all the time. And sometimes people self-diagnose, especially if they've begun to lose trust in health professionals. Autoimmune diseases are really, really difficult to diagnose. Someone might believe that they have lupus based on symptoms and preliminary tests, even if it's not formally confirmed. Early symptoms like fatigue, joint pain, hair loss, rashes, they all overlap with other conditions. And people sometimes actually misunderstand what lupus is. If Shanann had a lupus-like illness, but not classic systemic lupus symptoms, she or other people might have just referred to it as lupus for simplicity. There's absolutely no evidence anywhere that proves Shanann did not have lupus. This autopsy cannot be used in that sense because we can clearly see that further testing couldn't be done after her death. But let's just take a minute to examine what difference it would make if Shanann had lied about having lupus. Let's just say the people who think this way are correct and Shanann lied and didn't have lupus. Does it make a difference? No. Chris Watts' actions are not somehow explained or excused by anything his wife may or may not have done. The murders remain exactly what they are: horrific, unjustifiable, and entirely his responsibility. And whether you have issues with Shanann's personality or believe that Shanann belittled Chris or not, it still doesn't excuse what he actually did. Some have also pointed out that in MLM circles, like the Thrive business Shanann was involved in, there's often a heavy emphasis on personal testimony, especially around overcoming health issues. That doesn't prove deception in itself at all, but it does reflect how illness can become a part of someone's public identity, especially in wellness-based marketing. Again, none of this is evidence that Shanann lied. It's just one of the many complexities people now debate when trying to understand a tragedy that, at its core, still comes down to one man's choice to destroy his family. Ultimately, whether she had lupus or not doesn't change the outcome. but it does open the door to discussions about the pressures of online identity, how chronic illness is perceived, and the deeply uncomfortable ways that society sometimes turns victims into targets for public analysis. Let's take a second to just be really honest. This kind of doubting happens to women a lot. Chronic illness, especially invisible conditions like lupus, fibromyalgia, or endometriosis, they're often met with skepticism, especially when it's women who speak up. A lot of people assume that you're faking it if you don't actually look sick and haggard. And that mindset does real harm, both to victims of crime and to others living with these illnesses who are watching and deserve a little bit of compassion. The absence of lupus in Shanann Watts' autopsy doesn't disprove a condition. It only shows that it didn't play a role in her cause of death. Her choice to enjoy the sun or appear healthy on camera doesn't make her diagnosis any less real. And honestly, none of it justifies questioning the legitimacy of a woman who can no longer defend herself. Using a partial autopsy to discredit a chronic autoimmune disease is misleading at best and cruel at worst. Shanann openly shared her diagnosis, treatments and struggles. That should be taken seriously unless medically disproven, and it hasn't been. We should be focused on justice, not unfair judgment. We don't have to like anybody in this case. Nobody's asking you to like people. But what we are asking is for people not to bully a deceased person who can't speak for themselves. What do you think? If you've lived with lupus or another invisible illness, your voice matters, really matters. Share your experience in the comments below to help others understand just how varied these conditions can be. One of the most misunderstood aspects of Shanann Watts' autopsy is what happened to the fetus she was carrying at the time of her murder, baby Nico. Some people online refer to it as a coffin birth, while others mistakenly interpret it as a traumatic event or a miscarriage. According to these exact autopsy findings, Shanann's uterus was prolapsed through the vaginal canal, meaning it had been pushed downward and partially outside the body during decomposition. This is called the postmortem artifact, which we've been discussing throughout this video. It's not something that happened before death, but rather a natural effect of pressure and gas buildup inside the body after burial. The autopsy also describes the fetus as largely decomposed, lying adjacent to the uterus and covered in sandy debris from the gravesite, and it was still connected by a 17cm umbilical cord to a disrupted placental disc. These findings are consistent with what's medically known as a partial postmortem fetal expulsion, sometimes called a coffin birth. It's really important to be clear, this did not happen while Shanann was alive, and there is no evidence that the fetus was subjected to direct harm. As difficult as it is to discuss, it's a natural biological process that happens in some pregnant bodies after death, especially when decomposition has begun. This process is tragic, but it does not point to any mystery or further wrongdoing beyond the horrific crime that had already occurred. Now, here's another one of those moments where online speculation tries to poke holes in Shanann's credibility, but the medical facts don't actually support the accusations as strongly as some people think. Was Shanann lying about Cece's allergies? This comes up a lot, the idea that Shanann might have exaggerated or completely fabricated Cece's allergies, specifically that Shanann claimed Cece had a tree nut allergy, while the autopsy report only mentions a peanut allergy. So let's just take a look at the facts. Shanann did mention in several of her social media posts and videos that Cece had severe allergies, including to tree nuts. The autopsy, however, states only that Cece had a known peanut allergy. nothing is mentioned about tree nuts. Some people have obviously taken this to mean that Shanann was lying or misrepresenting her daughter's health, but here's the problem with that conclusion. Autopsies don't always list every single detail of a person's medical history. Unless an allergy directly contributed to the person's cause of death, or unless it's specifically listed in the records received by the pathologist, it might not be mentioned. Now, we see in the autopsy that the medical examiner is saying that Shanann's medical history is largely unknown. It's reasonable to take from that the medical examiner didn't have Shanann's medical history sitting in front of him at the exact time that he completed the autopsy. He may have had a few of CC's details to hand that might have already been passed over. He might have had a few of Bella's to hand that might have been passed over, but he might not have had the full report yet. And autopsies generally need to be done in a time frame in circumstances like this. So maybe the medical examiner just couldn't wait any longer to get the full medical reports for the victims. It is also possible that CC had a broader nut sensitivity, or that tree nuts were avoided as a precaution, which is actually very common. In young children with peanut allergies, doctors do often advise parents to avoid all nuts until formal allergy testing is complete, especially if there's been a history of reactions. Does the autopsy actually disprove what Shanann said? Not at all. It simply doesn't mention tree nuts, which may mean that the information wasn't available to the pathologist, wasn't confirmed by testing, or wasn't relevant to the autopsy findings. The bottom line is this theory leans heavily on a technicality, and it ignores how conservative and protective parents of allergic children often have to be. Whether CC had a documented allergy to tree nuts or not, it's clear that Shanann believed that she needed to be extremely cautious, and that isn't deception. That's parenting a medically vulnerable child the best way she knew how. Now we're moving on to one of the more painful and frankly disturbing rumours that circulates in some corners of the internet. It accuses Shanann of routinely abusing or neglecting Bella and Celeste, despite a complete lack of credible evidence. So we've gone through the autopsies. The autopsies show that there is no evidence of drugging or sedation. Both Bella and CC's toxicology reports were negative for diphenhydramine, which is Benadryl, other sedatives, illegal drugs, and prescription medications like opioids or benzodiazepines. So Benadryl is a medical drug classified under the group antihistamines, and it's used for the treatment of allergies, hay fever, colds, flu, and other allergic symptoms. Benadryl lasts and shows up on drug tests for different periods. So in adults, for example, it stays in the system for up to 2 days in an adult who is healthy. Drug tests can detect Benadryl in the urine for up to 4 days, in blood for 3 to 4 days, and in saliva in 3 to 4 days after the last dose. It takes longer to metabolize the older we get, so it only takes 4 to 7 hours for children's bodies to have the total amount of Benadryl in their system. So we can't necessarily say that maybe the girls hadn't had any Benadryl before their deaths, because the chances are it wouldn't have been detectable at the time Bella and Celeste's bodies were examined. In terms of harsher drugs, and just addressing the claims that people have made that Shanann was actively drugging Bella and Celeste with amphetamines, cocaine, and fentanyl, if she had been routinely drugging them with these kind of substances, then residual levels would likely show in their blood, liver, or other tissues, and that wasn't the case. There was no signs of neglect or malnourishment listed anywhere in the autopsy. Both girls had normal body weights for their age, and there was no signs of dehydration or malnutrition noted. Their organs, including the liver and kidneys, showed no signs of chronic stress that would come from being underfed, constantly medicated, or dehydrated. There was no signs of physical abuse listed. There were no bruises, scratches, or marks consistent with repeated pinching, poking, or physical mistreatment. The autopsy does note that there was some bruising and abrasions to Bella, which I think most people realise is from her being put through an incredibly small hatch on an oil tank. The autopsy didn't reveal any healed or healing fractures. The skin, bones and soft tissue were all intact aside from the injuries inflicted during or after death. These children were tragically murdered, but there's nothing in their medical or forensic records to suggest prior abuse by Shanann or anyone else in the home before that night. Regarding food and hygiene rumours, claims that Shanann fed the girls nothing but junk or didn't give them enough water, they're not based on fact, and they aren't reflected in observations from family, friends, teachers at Primrose. They're certainly not reflected in the autopsy reports. If young children are consistently dehydrated and fed junk, there would be changes inside the body to reflect that something was amiss. Shanann documented everything, from meals to medical concerns, on social media, and she was frequently criticised for being too structured and health-focused. Bottom line, really, if Bella and Celeste had been consistently abused, sedated or neglected, it would show through the toxicology and the autopsy. These rumours of child neglect and abuse, they're not just false, they're a form of posthumous victim blaming, and they really re-traumatise the families left behind. This is something we'll be discussing more in depth in a future video, so please stick around for that one. In the meantime, let me know what you think about the autopsy reports, the claims of the lupus being a lie, and the claims of the abuse and neglect that the girls supposedly suffered in regard to the autopsy findings. This is a really sensitive topic to discuss, so please, whatever your thoughts, whatever your opinions, have respect for all the victims and their families, regardless what your personal thoughts are. We don't need to resort to hate speech and drama. There's also been a lot of debate online about what really happened to Bella and Celeste Watts in their final moments. Specifically, questions about whether they actually were dropped into the oil tanks alive and whether their bodies could have even fit through the small hatch openings. And these theories often centre around these autopsy reports. Some people point to the fact that Bella had crude oil in her stomach and say that that's proof that she was definitely still alive when she was placed in that tank. Others argue that the physical condition of the bodies or the size of the openings makes it absolutely impossible that they were placed there after death. And some even go as far as saying that law enforcement set Chris Watts up with this and placed the bodies in the oil tanks themselves. Let's unpack this carefully and based on the evidence, not speculation. So one of the most disturbing and often misunderstood theories is the idea that Bella might have still been alive when she was placed in the oil tank. That claim does usually come from that one line in the autopsy report, which notes that Bella's stomach contains approximately 75 millilitres of a green-black sludgy fluid, which appears to be crude oil sludge. That detail has led a lot of people to argue that she must have swallowed the oil, something that could only happen, they say, if she was still alive and conscious. But let's take a closer look at what the autopsy actually tells us. First, while crude oil was present in Bella's stomach, her toxicology tests did not detect any crude oil components elsewhere in her system. No hydrocarbons were found in her lungs, blood, or liver. All places would expect them if she had inhaled or absorbed oil while alive. So this suggests that the crude oil could have entered the stomach after death, possibly due to post-mortem pressure, decomposition, or just being submerged for several days in a liquid environment like that oil tank. In other words, the oil may have seeped into her body after death rather than being swallowed while she was alive. Bella had some bruising and abrasions, a notable one on her left buttock. And these trauma injuries are consistent with forcibly being pushed through a narrow 8-inch hatch of an oil tank, resulting in further post-mortem injuries. So was Bella alive when she was placed in the tank? Well, based on the autopsy findings, no clear evidence in this report supports that. The oil in her stomach could be postmortem. The lack of oil in her lungs and bloodstream argues against active inhalation or swallowing while conscious. But what's most heartbreaking is what we do know. Bella was awake when she died. She tried to resist. She had physical injuries that show she was aware and afraid. That's the truth. And it's devastating enough without speculation. These children didn't just die, they suffered. And no theory changes the responsibility for that. Next week, we are hopping off Watts Island for a little break, working on the autopsies and researching all the decomposition processes and things has been hard this past week. And aside from that, I'm also aware that not everyone is here for this Watts deep dive and want to watch something else. So next week, we'll be diving into a mysterious unsolved case that's inspired a movie or two and a good few theories for those of you that like a bit of a conspiracy. This isn't the end of the Watts series. There's still a lot to go through, so please do stick around for the next instalment in 2 weeks. Thank you all so much for watching and supporting this little channel. I really do appreciate your time. I'll see you all next week in the next video. Same time, same place. In the meantime, stay curious, stay kind, and take care of yourselves. I've been Fiona, and this has been Case Continued.